Hello, welcome. Welcome today. Uh, it's my pleasure to welcome you on LifeScience Open Space 2025 in Kraków, the city of life sciences. I have this privilege and of course the pleasure to open this event for 17th time. Actually, it was quite long, and I've been opening all of these events from the very beginning. We started many years ago with the idea to bring to Krakow the brightest minds and to open the stage to those who believe in collaboration. That's the point. So again, this is my privilege to open this event in this year, as you see in this beautiful place. Very boutique, but very pleasant and encouraging the collaboration. The Kraków, since many years, becomes at this time the center of people from representing academia, business, R&D, hospitals, and governments. People who, as mentioned before, believe in collaboration and then gather together to exchange these ideas. The first idea for LifeScience Open Space and the name of the conference, especially the part of open space, comes from the open space technology, which is the notion somehow connected with the learning organization. So we are proceeding from the very beginning in this manner, in this area. We are a learning community. We are communities of practice. And that's our way of proceeding this. This is a changer. So I just wanted to stress these first words that this is not the conference you attend. You have to consider this conference as you co-create. That's a big difference. And actually, thank you for being here with us. The mission. The basic mission of this conference is to turn ideas into actions through collaboration. The word collaboration will be repeated here many times, so don't be bored. It's just make use of this. What's the problem? In May, as you remember, we did have this fantastic conference, Life Science for EU, where we discussed in which way we can do something together in order to support European strategies, especially life science strategy. And during that conference, there was a lot of discussions about the problems we have. We all face in Europe. That's fragmentation, adoption of innovations, regulatory issues, shortages of talents, and scaling of innovations. That's the problems we are facing. And also at the same time, Europe has a lot of advantages like fantastic science, new technologies, bright minds, and many others. And of course, this appetite for collaboration. So at this conference, we are practically addressing those issues in terms of in which way we can collaborate to have an impact, to change something that we care about. Again, our mission in this conference is to turn ideas into action through collaboration. That's the main point we want to achieve here. The formula. From the very beginning, we have thought about the formula of this event as a kind of place where you can meet so-called, the notions of raw materials. You know what's the raw material? The raw material actually for this conference is ideas, needs, challenges, opportunities. And for this conference, as you see, the collaboration comes first, not the presentations. So every presentation here, it's somehow or very directly or somehow touching the concept of problem of collaboration. Here is actually those presentations are taught and also are selected in a way that they enable collaboration or they invite into collaboration. Those from you who applied for this to speak here, to pitch here, I would say. You know that me personally, I was always asking or paying attention to this part where you had to explain why you want to present why you want to have your pitch, because this question why you want to present is very, very important. Just to say I am, or just to show what kind of any kind of opportunity. Second, it's a community-driven content. As you may notice, the content of this conference is being created till almost the last moment of the conference, because there is always someone who wants to present something, and there is always in last week that we received a lot of inquiries. Can I say something, or can I present something? This is actually a community-driven content. We are, as an organization, as a cluster, we are making on the framework for that for that conference, and the content is actually from the community. Third is we have this pan-European perspective, but what we want to do, what we want to achieve here, it's to show that how the Europe can collaborate with Central European countries. So we want to present these ideas, these developments, these needs or these opportunities from here to the world. And that's happening. That will happen. This is happening, and this will happen also after the conference. And the last point, last of important points, is that this is the platform. It's not the one-year event. I will be mentioning about that later, a little bit later on. But you have to notice that this is the platform really for collaboration. Where this way, we used to call this event also summit, because we are. In the concept, in the notion of LifeScience open space, we are working all the year, and we are getting together just to exchange some face-to-face ideas and meet face-to-face, because that's the very, very important part of this type of endeavors. Again, program overview. Just wanted to pay your attention to few. In which way we have composed the program. The composition, as you see here, is organized in a way that we are addressing those strategic issues we are dealing here in Małopolska, in Klaster LifeScience Kraków. But those issues actually are somehow also similar to those to global ones, especially those in Europe. So, future of prevention. It's in which way we can predict and make sure that our future is better. Tomorrow we'll have some discussion about that, and also the first keynote today is about the one of the most important issues in our health, which is the prevention. Very much. Not very unappreciated issue of this question, and in which way we can address and develop the innovations in that area is very important thing. Then next generation therapies, which includes a lot of issues from biotech, in silico technologies, digital twins, personalized medicine, etc. A lot of information and also presentations here. Reimaging healthcare. There's this issue is becoming very, very popular and very, very strongly addressed here in Europe, especially because there has to be some kind of change of paradigm in which way the healthcare is being provided. This paradigm is actually this change of the paradigm is very much connected with the first point with the future of prevention and green life science. We have to take care about this sustainability aspect of our developments. Then this is for today, and startups and scale-up zone. We have always this part of this conference devoted to addressing the needs and opportunities for startups. And this year it's grown actually to the level that it's very hard to make all those startups together to pitch very in very organized and effective way, but this can be done. And tomorrow's session, which is ending the conference questions that matter. We have introduced these sessions 3 years ago, and it seems to be very interesting. The discussion about the questions we should asking, and of course inspirations. This is again for today. Inspirations, the night with nice talk, nice music this year, Cuban music, and maybe some dancing. We'll see, but this is kind of event you don't want to miss because of a lot of opportunities being covered in that way. And of course, exhibition, you can meet all of this fantastic organizations presenting their offering and talk directly to them. So don't hesitate to do that. And of course, the hidden part of the program, it's the platform LifeScience Open Space. I'll mention about this a few words. The LifeScience Open Space platform, I encourage you to go there and to explore this platform, because you can connect on this platform with every member. There are only members which are interested and involved in life science innovations. I can browse projects, offers, pitches of different types and profiles. Also the pitches and profile and presentations from the previous years of Life Science Open Space. And also this one will be recorded and put on the platform after we finish. And also you can directly book meetings with every member of this community on the platform, and also you can continue collaboration after the event. So this is the new endeavor from our side. It's still being developed, but it's worth to be there to explore opportunities. It's about the being of this type of conference is about asking a question: what is the real value? And the real value is actually what you get from that, in which way you want to get this value. And you can do this in two levels: individual, personal, and organizational. When you think about this individual level, you have to ask yourself, what is this for me? How can I be in contact with those who present here, with those who exhibit over there, with those who keep asking questions, with those who are present actually here? And that's one way of exploring. And second, in the organizational level, it's the way to find out partners for European projects. Find out partners to explore your ideas, to learn, to teach someone about your ideas, and to learn from others about your ideas. When we talk about the collaboration between organizations, we invite organizations, but it's always people who collaborate in these organizations. It's actually good to learn from each other in which way it is possible. And of course, it's very important to thank at the beginning and at the end again to all the partners who made this edition possible. As you see, they are not on the slide because there are so many of them, but you will easily notice that the city of Krakow is actually the main partner here, and we are collaborating with the city with organization of this event for many years. But the others like Jagielloński Center of Innovation, Krakow Technology University, EIT Health, and others, they are present and they are supporting us, and we are very thankful for supporting us and collaborating with us in organizing this event. So again, welcome to Life Science Open Space 2025. Everything what you have to do during these 2 days is explore, connect, and collaborate. And actually, when you think about in which way we can benefit all, it's simple that we can make our collaboration the competitive advantage. So let's do that. And that's all from my side at the beginning. I will be showing again tomorrow at the end of the event. Now I will invite our. So in this way, we'll start the first session, which is devoted to the prevention. So we'll be talking somehow about the future, and I invite Adam Sajdak, who will be kind of chair of this event, and Adam will lead you through the whole session. So thank you very much. Thank you for being here again.
Thank you very much, Kazimierz. My name is Adrian. No problem. I'm a proud leader of this session, Living Longer, Future of Prevention, Living Longer, Living Better. My role is taking care to time, taking care to organization of this session. So let's start. First speaker, Roman Topór-Mądry from Uniwersytet Jagielloński. Topic of presentation is Prevention as Strategy, Designing Innovative Health Systems to Maximize Population Health Gains. Let's start. Thank you.
Thank you very much. Thank you for the invitation to this great event. Of course, you know, the prevention is a word we spell, pronounce, try to engage in the system for many, many years. And it, as we can see, it's just most of the time is some kind of idea. We spend about 2 to 4% of budget, healthcare budget for prevention, but we still think it's most important idea in the healthcare. Of course, as the president told, you know, it's very much connected to the system. So that's why there will be some analogies to this. Of course, we need to understand the definition. We need to understand what's the difference between treatment and prevention, what's health, what's risk factors, how we measure outcomes, how we build resilience in the system. All of this topic we will pass through the presentation, but this is just for you to follow the path of the way how we think. As currently we see the health needs, and we try to get health assessment, the people in the different state of health, and of course we want to make some intervention which makes these people complete health. So means all of us in complete health. So we, of course, can answer what are the needs. We can answer what could be the intervention, and of course, we can do monitoring, kind of assess the effectiveness, quality, and so on. And we call it health system. And of course, it's much more beyond this, because most of us, maybe we could say even all of us, get birth in a complete health, and something happened here, and this is something which we want to stop. We want to prevent, and the prevention is just about this, not going to this worse state of the health. And of course, this also is a health system and should be a task for health system. So the definitions are very easy, because we have the clinical medicine, which focus on patient. We have diagnosis, the treatment. We may have offices, clinic, hospitals, and so on. But of course, we have public health, which is population-centered. And the primary activities are disease prevention and health promotion. And of course, these two ideas are not contradicting. We can make prevention on the individual level, and of course, if someone has a risk factor, so to prevent risk factors, we do these activities on the individual level. However, of course, we have different settings. We have preventing a primary, specialized care, chronic, long-term, and so on. So in this system, as we can see and we can imagine from the everyday life, most of the facilities and institutions are connected to this clinical settings, not to the prevention. And of course, today is a time when we start to think that how to change this idea. We have, of course, a different approach to the promotion. We have, let's say, classical levels of prevention. You have primary, secondary, tertiary. The primary is the most important. Prevent disease before the onset. And of course, we understand that treating or finding in the type of early detection the disease is much less effective than to prevent disease. If someone is still healthy, let's make him healthy for all the life or most of the time we can achieve. Then this second is, of course, kind of screening and prevention complications of diseases. So good treatment makes also this secondary prevention. And the third area, reduce complication and disability. So these three levels are on the way of our health. The other idea of the prevention is whether we should focus on the general population, like all of us are fully healthy, so we can make a nice health promotion and this population strategy, not focusing on high-risk person. However, if we find a high-risk person with already background for a disease, so we can target these special groups with more intensive intervention, and this is this second type of strategy. There was a long dispute and analysis which is more effective, and as we understand, both have some good effects on different levels. This is, for example, we can see on I don't know, diet, on smoking cessation, or smoking prevention, and this is for high-risk patients already with the disease, so where we know that the diet can improve the complication of disease. So what's the challenge? And the challenge is here we can see that this is from the last very few days published OECD report, and we can see that always we have Poland here, we have life expectancy, but we have something which is preventable, so we call it avoidable mortality. We can see that the Poland always here is worse than OECD average, so this pink is not nice in this slide. So chronic morbidity, separated health, we can see that the challenges are all around, and of course, you know, Central Eastern Europe is very much pronounced here on this table, and of course, the biggest risk factors which can say between 40 to 80% we can save of this mortality, of this health problems. It's smoking, alcohol, obesity, and air pollution. Yeah, so there's this four topics, and we can see that's of course here it's better than OECD average, but we are not very happy because still it can be less, as you will see on the next slides. Cigarette smoking, you can see that is here. So the Romania, Croatia, Italy, Hungary, Bulgaria smokes more, but of course it's very, very surprising, you know, cannabis smoking. Poland is just after 2 countries, which I don't know, you know, as you understand that the analysis and the gathering data is a clue for the conclusions. So this is probably by the questionnaire, and the validity is somehow different. This is alcohol. You can see, and there are the risk factors, global risk factors. You can see malnutrition, high blood pressure, air pollution. But for Poland, when we can see it's tobacco, high blood pressure, dietary, high body mass index. So these are the top most of the problem with for the country. When we look at the map, and of course we can see that all causes attributed as risk factors. We can see the variability in the regions, and of course it's pronounced in the life expectancy when we are happily living in the regions where this life expectancy is the most, and I encourage everyone to stay to the end in these areas. So, and of course, why this? We made analysis lately published in Lancet Europe. what happened in these 40 years and where we achieved life expectancy, you can see that some countries, some regions can get, like Mazowieckie or Pomorskie, even more than 8 years during these 30 years. And by different type, of course, mostly is cardiovascular diseases. In oncology, we didn't get much better achievements. And of course, smoking, as you see, the biggest issue in the prevention. We have yes, Western Eastern Europe, the countries average for Poland, and this is the change. You can see that the different regions had this change in different speed. So Świętokrzyskie got the most, and Śląskie got the least. But finally, the smoking variability also is huge. Similar for high systolic blood pressure, which could be, of course, once preventable and the second treatable very easily. And of course, it's not done effectively in Poland. So there are the challenges, and of course, the spending for the health promotion is, for the prevention is, as you can see, very, very small. Of course, there are some countries which spend more, 5%. We spend 2%. Yeah. Oh, this is the end of the table. Yeah, that's Romania, fortunately. So this is the state of the status of the situation. Of course, doctors, the numbers changes, because the recalculations, different approaches to this number. But of course, we can understand that that in future, when the population gets older and we have more chronic diseases, any number of medical personnel wouldn't be enough, unless, of course, we can see that AI can do anything and we don't need doctors anymore. But it's not the case, and as more we discuss and analyze AI tools, we know that's supporting way, not replacing the medical personnel. And of course, what we can see, it's very nice. We have plenty of CT scanners, PET scanners. Even we can look that there's more and more exams made, but whether they get any effect. And this is the problem. As similarly here, you can see in the report, Poland has access of electronic health records is 92%. And I wonder whether you, being in the healthcare, close to healthcare, are familiar with this huge number, which probably is not true, because the electronic health records are in different states, and of course not very easy accessible. Some people still have some procedures made in the national system, in the national portal, which were never been in this doctor. So how to measure gain? And of course, we can measure gain, but the effectiveness of the health system, there's accessibility, quality. We can look at life expectancy and avoidable mortality, and we can see that the money probably is not enough to solve this problem. We call it money paradox. We think we can buy anything for the money, but of course it's not true. Also for the health system. Here is Poland, here is Germany, and of course this gain is not very, very big. Is prevention better than cure? And of course we think, of course it is, but some diseases are unpreventable. Sometimes, of course, I needed. In the formal analysis, it very depends. I will show you just a few slides on this. But of course, when we can look, is cure is prevention clever than cure? It looks like the cure is clever. The prevention. When we look at the Nobel Prize candidates, we can see that for cure they made 12 achievements, and for prevention only 2. It's something say something about the attitude of all over science to this idea. I think we can look carefully on this. This is a very nice publication. What the lifetime costs across health trajectories for obese cohort, healthy living cohort, and smoking cohort would be a nice example. And we expect that healthy living cohort expected remaining lifetime cost, healthcare cost would be lower, but it's not. They are the highest. Yeah, they are the highest costs for the healthy cohort because they live longer, and of course they take more health services, they get other diseases and so on. So we have to think of this, that the costs of prevention, that's not only investment, but also we will have longer living population and a higher cost. Whether the cost effectiveness is nice for preventive, when we look preventive measures versus treatment, and of course it's not so easy. We can see that if there is for the cost saving that's a little bit higher here, but for this less than 10,000 per QALY is opposite. The treatment is better, more cost effective, and it's really variability. So this is not a clear answer that this prevention makes us wealthy, at least for the health system. Of course, we can ask, does this prevention save money? And this is probably a wrong question. We should ask, does it provide good value for the money spent? We have to spend the money, and is it worth spending or not? What we get from prevention, we of course get more life years, superior quality of life, preserve human potential in the human capital in the families, reduce suffering, which is invaluable, and of course increasing value of health. So we can think, and we understand that many important values behind prevention. We can summarize it like Jeffrey Rose, that say the preventive measure which brings much benefit to the population often offer little to each participating individual. And he also said that it's better to be healthy than to be sick or dead. So we understand that they agree with these statements all over. So finally, what's the model is, and we are creating now the models for resilience after pandemic health system. We make the graphs and so on, but do we think really about prevention? And this is the concept that we should try to use and create the system which incorporates prevention as important element, and of course use all of the achievement of science and technology in the system. So this is continuous learning adaptation. It has to be fast. We cannot make reforms for 20 years and then make another reforms for another 10 years and another 20 years or 30 years. We should be anticipatory rather than reactive. We are now reactive. Yeah, when we are losing money and there's no money in the budget, we say, "Oh, what happened? Why we haven't known this?" A few years before, maybe we have known. Value maximization across continue. So we should look at the value, not in the small effect like number of health services, which is really dominating in the health system. We can say how many hospitalizations, how many health services, how many CT scans we can make. Why? This is not bringing a value. The value is in health. Of course, we should make personalization. The technology should be enabler, not the end. Sometimes we just think, okay, we introduce this new technology and we are happy. No, it's just the beginning. The new technology which should us enable to get better health. And of course, social capital integration. So not thinking that the health system is something different from the regular life, but it should be together. And of course, incentive via outcome-based financing. So financing should be based on the outcomes. And of course, we can look at these ideas and try to think of using data platform, AI, digital twins. We will be discussing about this as well, adaptive HTA, and so on. Why is it different? This is traditional health system. This is this idea of new system, anticipatory, dynamic, rapid. Of course, the prevention should be expenditure should be increased. Of course, precision. We should get the digital twin to make in silico analysis, so we understand what's gain we get, and then we should monitor after implementation whether we really got this working outcome-based formal component and so on. And this is plenty of other detailed tools how to achieve this, and of course for the prevention, make use of all these technologies we see. I haven't seen any of these really implemented in the big scale in any countries. Now NHS says that in 10 years they will transfer the system for new values, and of course it's a new director, so maybe he has to say something for the beginning. We understand that the story of English reforms is longer even than Polish. Mir Gray, head of NHS for I don't know, 40 years. He said he survived 28 reforms of health system, and of course it didn't change much, as you know the UK system. And of course we can measure this. We can finally monitor, and we can see how much we can get from the prevention. And this is our aim. I understand that we agree with all of this. For the health system planning and for using the tools we have till now, we should go from this descriptive analysis, what happened? Just retrospective analysis, what happened? Why we should go towards why it happened, what happened, what was behind this, what is happening now. But we should go toward what is likely to happen. We should have this predictive analysis more and more, and of course they should be validated. They should be reliable, and of course from this level we should go to the point of predictive analytics. So what do we need to do to get the effect? So this is the approach we are incorporating in Interdisciplinary Health Data Center at Jagielloński University, and we welcome you to cooperation. Thank you very much.
Thank you very much for those of statistics, some scary statistics, but it was a big inspiration to taking care every day of our health.
Sorry for the moment. One word. Roman will be tomorrow at the session of Questions That Matter. And that will be also opportunity to ask Roman questions, because now there is actually little time for that. So I invite you for this tomorrow's session. I have a few questions already.
So, next speaker is Piotr Augustyniak from AGH University of Science and Technology with topic heart rate monitoring in free runners from a flying drone.
Thank you for the nice introduction. Actually, the name of our university is AGH University of Krakow since 2 years. And I'm going to introduce as one of our solution, which is heart rate monitoring during the in real time from running people. So first of all, we use a video plethysmography, which is a technology known since the beginning of 2010. And it consists in measuring the color of the skin in a very precisely defined region of a skin. It's usually the forehead, because capillary vessels are very shallow then. And the advantage is that the method is not in contact, that doesn't involve any hygienic issues, and you can even measure the blood pulse in people without the conscious known of that. So I can measure actually your blood pressure now. I could do it. But the disadvantage is some vulnerability to the lighting, because it's used ambient light. So our first milestone was just to repeat the experiments of the other. In 2016, we was able to just to fix a region and to measure highest peak of the color variance. And in 2019, we applied the same technology from one image to setting several points in order to first to select the best measurement region, then to measure the delay between the pulse wave in different regions. Next, we made the same in order to assess the pulse velocity in the blood system, in the circulatory system. And finally, we patented some solution to monitor people at sleep, just using only the infrared camera, the visual light camera, and selective lighting. Next thing was going from the lab to the field. So it was not enough for us to have a laboratory setup with a volunteer sitting in front of the camera. That is in some way unnatural. So this is in fact my passion. I'm a drone operator at private, and I thought, okay, each drone has a camera. It's in fact a flying camera. So what if I make a drone accompanying and running people? And that was an idea since 2021, 22. However, there was plenty of questions, technical questions, because a drone is moving, the volunteer is moving, it is shaking, it is not running the same way. The drone cannot actually precisely accompany the human. But those questions are challenges for a scientist, and we try to answer at least some of them. Drones usually have three kind of civil applications, so transport, observation, and sports. So we use the observation modality of that. However, a human is not quite easy, because law is that you cannot fly as closely to the human as you want, and the drone has usually a wide-angle camera, so you cannot focus precisely on a skin. Otherwise, if you apply a narrow-angle camera, that's not very easy to stabilize an image. It's even harder. So that's an example with a cow that it's probably the maximum distance so we can approach to the animal or to any human living. And we moved the experiments with a moving individual, and the aim was not actually related to the to video plethysmography, because we already knew this, but how to track and identify the open skin, bare skin areas, and how to measure the pulse rate there. That's technical details. We use the Polar H10 as a pulse reference in each participant, and we ask the participant just to run in the meadow. It was in Błonia Krakowskie meadow in the middle of the city. It's allowed to fly the drone there. So after one of the problem is that if you ask the drone to send the video signal directly, the signal will be highly compressed, and the compression as itself modifies the image and influences the accuracy of possible pulse measurement. So it's not a good way. So we recorded first the image on a data card, flying data card, and then process the video. And that's an example of a segmentation of the body. So having the body, we applied several methods to track the posture and to follow the posture from one to the next video frame, just to keep in touch with what the participant is doing. And finally, we tried the same at multiple people just to see how they run together. They definitely have different pulse rate. And that's a setup. That's me as a drone operator, and that two volunteers running. That's another setup with one volunteer, and they don't do any predicted predicted path, and neither predicted speed. Just come slowly from walking to running. And that's our results. So as I told, we had the polar reference, and those results were quite disappointing. So we had at most 17 BPM accuracy, which is not correct, but we focus first on how accurate was determined the open skin areas, and our final results are improved. That we can even segment our open skin very precisely, and then we got the result comparable with the blood monitor, worn blood monitor, or even a clinical one. So that's our story. Welcome to cooperation, but be aware, it's not very easy technical topic. I don't know whether it is running. Okay, that's the system at work. So the lightning means that there's skin areas where the data are actually collected. Okay, that's a spectrum, and the highest peak is taken as a blood pulse. Few words about this practical implementation. So we are going to make a drone as a rescue flying apparatus, which could achieve which could serve for disasters with several participants, which could operate in remote areas like in the mountains or in islands, and which can reach the place of disaster much faster than any human rescuers. Thank you for attention.
Thank you very much. It was very impressive. I'm a sportsman, so it's perfect for me, but I think it's a very good solution to living longer, living healthier, so thank you. Next speaker, Julia Godzwon from AGH University of Krakow too. Title of presentation, SilverMind, Smart Care for Sharp Minds.
So, good morning, everyone. Hello, ladies and gentlemen. My name is Julia Godzwon, and today I'm pleased to share this presentation with you about the SilverMind Smart Care for the Sharp Minds. To start with, I would like to give you some definitions that will be used later. First, dementia. This is a set of symptoms like losing our memory and also some language functions and the ability to function normally each day. And Alzheimer is a disease. It starts with some memory losses, and it progressively is getting worse and worse. First, why it matters? Because all over the world, over 55 million of people suffer dementia. And according to some researchers, by the end of 2050, this amount will even triple. That's why the cognitive training may delay this decline by even 40%. And here we can see some more numbers. During my 2-minute speech, around 40 people may suffer or develop dementia. So that's quite a big amount of people. And over $1.5 trillion is spent worldwide for the dementia prevention and the dementia treatment. Why the problem is so important? Because a lot of seniors live alone, so nobody may notice the problem. Yes, they start forgetting basic stuff, and later we realize that they are ill, they suffer dementia, or they suffer Alzheimer. And here comes my solution. I would like to design an app with some personalized cognitive training based on short brain workouts lasting around 10 minutes. And what's most important, with senior-friendly interface. So the app won't be complicated, just some simple stuff. I would like to track the progress, to maintain or develop some new habits, and to make a panel for the family or the caregiver, because sometimes the family of the senior lives far away from them. That's why it's important to make it possible to monitorize the status from all over the world. And now let's come to my guiding values. A, B, C, D, E are also easy to remember. A goes for active aging, B for brain health, C for the cognition, and D for dementia prevention, and the last one, E, for empathy through the technology. Here I made a graph based on the research, which games may be in this app to help the seniors. First, some memory games to activate or simulate the hippocampus. Maybe some reaction speed drills to help them make the great coordination between the vision and the movement. Also, some classic board games like the jigsaw puzzles or chess. And what's the most important, I think, some tasks. Here we can see some sensory and routine breaking exercises. I would like to add it to the app. For example, each day the senior would get a task to do. Like this day, you should wash your teeth, for example, with your left hand instead of your right hand, or wash your dishes using your hands instead of the dishwasher. So some simple changes in the daily routine. And now, how it works. First, there will be a quick assignment, like during lasting, I don't know, maybe 3 minutes or something like that, to diagnose the problem, to see the level of the seniors' attention, seniors' memory. Then the AI-driven personalization to adjust the level of the task to the seniors' level of the memory, and then some motivation and habits formation due to the progress tracking. So how would the senior's journey look? First, senior needs to download the app, then make this 3-minute test, and about 10 minutes of daily training. After that, they will get the weekly progress report and the panel that I mentioned before, the panel for the caregiver to track this progress. Here we can see the app. So here is the logging panel for the caregiver. Here you can see the daily challenges. There are 3 challenges that will last about 10 minutes, as I mentioned before. And here's some more games if they want to practice even more. They can see their progress based on the last session and also the whole progress of the training. And here's some more games. And what's the roadmap of this project? Now I'm here, I'm creating a prototype, so I'm searching for the collaboration. Maybe somebody who is more keen into the neurosciences or somebody more keen into app design. So I'm open to the collaboration. Then I would like to make some tests with the seniors to see how it works. Then prepare a full beta version and hopefully launch in the future. So now, to describe it to you, some real-life scenario. Here we can see Jane, she's 60 years old, she lives alone. She starts forgetting stuff, simple stuff. She forgets her neighbor's name, she forgets what she wanted to buy. She can scroll, yeah, it's easy. But she can also download the app and practice to be a happy Jane, not a Jane that forgets her child's name. That's a real-life scenario that we can maybe together make possible. And at the end of my presentation, what I expect, like after the launch of this application, I expect to reduce the cognitive decline speed and to improve the attention stability and also the habit tracking, habit development with seniors. And thank you for your attention.
Thank you. Okay. Thank you very much. Prevention of dementia is extremely important thing in our times, so thank you for that. Next speaker, Emilia Piotrowska from AGH University of Krakow. Title of presentation, MediLyze, an intelligent system to support pharmacotherapy safety.
So, hello, my name is Emilia, and I'm happy to present MediLyze, a smart mobile app that helps make taking medication safer. MediLyze checks the interaction between drugs, disease, and food in a clear and simple way, created especially for the needs of patients in Poland. Medication safety is still a big challenge, especially for older adults. Taking many medication at once greatly increases the risk of interaction and side effects. Current tools usually checks only some interaction, not all of them. None of them shows the full picture, drug-drug, drug-disease, and drug-food interaction, and almost none support Polish commercial drug names. MediLyze was created to solve exactly this problem. MediLyze gives clear and easy to understand information about interaction on 3 levels: medicines, chronic disease, and food. User can also check possible side effects and better understand how and when to take their medication. The app is simple enough for everyday users, but its structure still follows the logic of real clinical decision-making. MediLyze was built in Flutter with a SAPA-based backend, which gives the app fast performance and easy scaling. But the heart of the system is the interaction engine. It identifies risk and shows results in real time. The most important technological part is the database, which was fully designed and created specially for MediLyze. One of the most important parts of MediLyze is custom interaction database. I found that not existing database had the information I needed in the right format, especially when combining drug disease, and drug-food interaction, and including Polish commercial drug names. To solve this, I built the entire database manually using only official pharmaceutical documents, CHPL from the Polish URPL registry and SMPC from EMA's EPAR documentation. I work mainly with section 4.2, 4.5 and 4.8. Dosage, interaction, and side effects. Every interaction and warning in MediLyze comes from verified regulatory sources. This kind and unfitted database did not exist before. It was created completely from scratch from MediLyze, and today it provides a strong scientific and clinical foundation for future development and partnership. I conducted study with 20 participants to check both of usability with the accuracy of MediLyze interaction engine. Users reaches 92% accuracy when identifying drug interaction with the app, and 85% said the interface felt intuitive. These results show that MediLyze is clear, easy to use, and reliable as a support tool. Let me show you a real-time example of why MediLyze truly matters. This is Anna. She is 7 years old and lives with hypertension and type 2 diabetes. Like many older adults, she takes 7 different medications every day. One day, Anna receives a prescription for a common NSAID to help with joint pain. It seems simple, just another pill, but when she enters this new medication into MediLyze, something important happens. The app instantly detects 2 serious risks. One, a high-risk drug disease interaction. The NSAID can raise her blood pressure and make her hypertension medication less effective. 2, a significant drug-drug interaction. When combined with her diabetes treatment, the NSAID may increase the risk of kidneys problem. MediLyze immediately show a clear warning, high-risk interaction detected. This combination may worsen blood pressure and harm kidney function. And then, instead of leaving the patient confused, the app gives simple, actionable steps she can follow before taking her next dose. This is exactly the kind of the moment where MediLyze can prevent complications, support safer decisions, and help people truly understand their treatment. The project is built to grow. I plan to expand the database, add machine learning models that can predict risk, and create a clinical version for healthcare professionals. In the future, MediLyze can become a validated medical tool that supports hospitals, clinics, and telemedicine platform. I'm actively looking for collaboration opportunities with researchers, clinicals, industry partners, and investors. Whenever there's a clinical validation, expanding the data, or developing new features together, I'm open to working in many different forms of partnership. MediLyze is based on real needs, tested with real users, and powered by a unique technical foundation. It's ready to grow into a meaningful tool that improves medication safety. Thank you very much. I will be happy to talk about collaboration ideas after the session.
Thank you, Emilia. Okay. Thank you, Emilia. Thank you for reminding me. I forgot my supplements this morning, so it's really important thing for young people too. Next speaker, Katarzyna Sterecka, Polish Institute of Neurodiversity. Title of presentation: The Future Thinks Differently, a New Era of Intelligent Diagnosis. Katarzyna? Yes.
Hi, everybody. So I see that there was a change in the program then. Surprise, surprise. Okay, yeah, let's begin. Have you recently heard that everybody has little ADHD? Or that you look a little bit autistic? Yeah, today more and more adults seeks for answers about why they feel or function differently. And despite the growing awareness of ADHD, autism, and other neurodivergent profiles in adults, the diagnostic system is struggling to keep up. Let me start by introducing you to one person who represents the reality of a neurodivergent people every day. This is Marta. She's a 38 years old psychologist, a diagnostician. She runs her own business, her own practice, and she's got about 20 patients, adults, neuroatypical. She works in Krakow, and she's specializing in neurodiversity assessments. Marta chose her profession because she knew that what it means to feel different in a world that isn't built for it. Every day, Marta steps into deep conversations with each client, listening to their stories, but also their struggles. And her role is to guide them during a long and complex process of diagnosis. But when all these conversations, hours and hours, ends, Marta's work is far from over. All those notes, all those insights, she must revisit them, analyze them, and connect the dots. And here's something most of you probably experienced yourself. Imagine that you're building a product, you're creating something new and really interesting in a huge project. And after all that time, at the end, the bureaucracy comes. And you need to create all these documents and papers that are really like, this is the most boring step. And the part you postpone as long as you can, but at the end, you always dream that it never exists. For Marta, that's the detailed, long process of creating the psychological opinion for every patient. The diagnosis is long, manual, and subjective in the assessment. Multiply it by 10 for every neuroatypical she's facing every month. And here is Nuray. We are coming with a product consisting of 3 parts. The web application, the video bot that conducts the interview with the patients. Then the analytical module and the panel of statistical dashboard for the specialists. We talked with specialists and experts, psychologists who are conducting interviews with neurodivergent patients. And this is what we heard. 86% declares the need for work automatization. It's a huge number. It's unmistakable. And 73% of specialists are eager to use a supporting tool during their work every day. We focus on Małopolska region, where there are more than 1,100 specialists, psychologists, and this enforced our why. There are up to 250,000 undiagnosed people only in our region. Scaling it to the entire Poland, we've got 2.5 million undiagnosed people. Our roadmap, sorry. So we are currently in the phase of extended market research. We are still talking to specialists on the details of their work and their needs. Then we also are actively seeking for mentoring and acceleration programs and looking for research partners like universities or research facilities, but also clients who will be our beta testers. And we aim to create the MVP until the end of the next year. So yeah, this is the person with the vision that you can see today. But nothing would happen without Matti, who just came. Yeah, thanks. Came back. Thanks, Matti. And we both have psychologists and IT teams. And our great advantage is our network of neurodivergent specialists and experts all around Poland, as we work directly with these people. And in our team, we share a common mission to create the psychological diagnosis more accessible. Okay, coming back to our character. So the patient is taken care of in a safe and friendly environment. And our psychologist, Marta, finally can focus on what is really important. So the analysis of huge amounts of data and the accurate diagnosis result. Who are we looking for today? Psychological clinic who would support us and work with us as experts, researchers as well, so universities, facilities conducting research, and teammates, of course. So feel free and to join us, and we'll be very happy to speak with you after the presentation. And thank you for listening to me. My name is Kate, and we're at Nurai, are beginning our journey to really create the environment for new intelligent psychological diagnosis. Thank you. That's my LinkedIn profile, so feel free to scan the QR code and contact me via phone or mail.
And the last speaker in this first time of this event, Alexander Babko from EPAM. Title of presentation, Accelerating Patient-Centric Innovation, Lessons from a Smart Nose Hospital Pilot.
Thank you. Hey, hello, everyone. Yeah, so it's a pleasure to be with you all here today. My name is Alexander Babko, and I'm Program Management and Innovation Director at EPAM. And today, I joined this fantastic event to tell you a bit of a story. A story, to be honest, like a bit bad-smelling, because the initial question that we have been dealing with is how can we know in real time when patients that might be in very bad conditions in hospitals, how can we know when, who, and where needs their diapers to be changed? So the story needs a little bit of context, because we at EPAM, we are engineers, first of all. So we are not really dealing with diapers. But at the same time, whenever we are solving complex problems for our clients, like most of them revolve around software, data, AI, digital, clinical tools for researchers, for digital health and other data-driven solutions. So oftentimes, clients trust us with some physical and integrated solutions. Like, for instance, we helped Unilever bring the laser skincare from clinical grade to people's homes, or help to engineer the Omnipod to manage insulin as a wearable device. So the list is long, both for software and hardware. But the thing with the Smart Nose, which is pro bono, non-commercial initiative that I'm here to tell you all about today, started with an innovation hackathon. We were running, a couple of years ago, we were running an innovation hackathon in Vilnius in Lithuania, together with local communities, with local healthcare institutions and other partners locally. And one of the ideas submitted by one of the healthcare practitioners was directly from a director of local hospital, St. Rokas Hospital in Vilnius. He said, "You're very smart guys. How about you apply your knowledge and your skills to help us, like to help nurses basically know which patient in a very bad condition, sometimes it's post-operational, sometimes people cannot get out of bed, sometimes they're like very elderly public. And the thing is that regardless of their needs, they get their diapers changed twice a day, in the morning and in the evening. That's pretty much it. Whatever happens in between, unfortunately, nurses and medical personnel are very thin spread. They're overloaded with the clinical tasks, with lots of work to do, and that results in discomforts, in skin irritation, in risk of infection. No need to say that. You pretty much know what it all can mean. So it all started like that and resulted in a pro bono initiative that we were running for the last couple of years. So it's not like a lab experiment. It's real environment in real hospitals where we created this tool. The tool is here. It's like an example. I took it from the hospital one of the days. So kind of like one of the sample replacements. Right now, basically, we are running this pilot in hospital in 4 patients' rooms with real patients. It's a connected device. It has some sensors that sniff the air, that detect the required concentrations that require attention of medical personnel, process on the edge, and notify medical personnel that this or that patient in this or that room is waiting for that amount of time. So the idea is to decrease the hours that patients wait for that from hours to minutes. So as I said, it may sound simple, but for us, it's an engineering problem because we are engineers, and whatever we do is also all about that. And that may be not that simple or straightforward as one can think about it. There are many, many challenges. And first of all, they gravitate around how can you detect that? Because as nurses, as medical practitioners, as medical personnel, people can check it. They can come to patients. They, of course, know what diapers mean and how it works. But for us, we think about that from technology perspective. How can you detect the proper gas, for instance, H2S in this particular case, combined with volatile organic compounds like VOC sensors? How you make the data fusion between these 2 sensors? How you enrich one stream of data with another stream of data? How you detect the thresholds? How you figure out with remote team, you need to train the model. And how you do that? You cannot get thousands of diapers. That's why our teams, with help of our specialists here, we at EPAM, we even have chemical and biocompatibility experts who also help with that kind of questions. Not something you would expect with, hey, it's a simple device. No, it's not. So we had to even design some chemical setup that we could recreate in Lithuania, in Poland, in Turkey, in other locations, so that our engineers could train the model and identify what is what. When it's time to call for a nurse, when it doesn't make sense to call for a nurse yet. So all of that is super important. But then data labeling with all the false positives, false negatives. So all of that exists like in real life, even like with such simple thing as like changing the diaper. And then when your nurses become a little bit of a junior data scientist, I think that's something that they can even write in their CVs, right? Because it's not that obvious, but they actually contributed to that. Then whenever you're dealing with hardware in hospital, that's not a trivial thing, because obviously there are regulations. You cannot just like plug in power here and there. You cannot violate any procedures. So that's all super important. And doing that right is not a simple thing. Then, of course, there is a smellscape, like landscape, but we call it smellscape. So in this particular case, whenever we can sniff something as people, the technology needs to do the same, which means that whenever someone cleans the floor with extremely aggressive materials, then sensors can like die. What you do in this case? So we also had to filter this noise and like focus only on very specific, very laser-focused needs of this particular sensor, room setup, and then make it adjustable, because kind of like it changes. So today, one patient came, next day their relative came with their odor, with like, so it's invisible. But for technology, you need to see it like that through invisible lenses. And of course, like, yeah, some patients were super happy about that, so they took sensors away with them as artifacts when they were dispatched back home. As I said, like the very key learning here for us was to engage clinicians from day one, like even from day zero. They themselves submitted this idea. Probably they would never had a chance, like as a local small hospital, to work with world-class engineers. I mean, a bit not humble, but that's true. But that was like for us a very interesting way to interact. So when our engineers, like for instance, when they had some free time or on the bench, they came to the hospital to spend like a working day there, just to observe, to look like what happens, how to help nurses, how to improve their processes, how to make patients' life a little bit better when not many people care about them. So that all resulted in the minutes instead of hours when patients get their diapers changed. Of course, like that results in comfort and very quick and clean alerts when nurses need to know what to do. But the thing is that it proved that there are a lot of ways to make people's life better, to contribute to local communities. And so the main theme of this event is also about collaboration, about partnership, about local interaction. So this is exactly it. That's what we built in Vilnius, and invite everyone to do it like that here in Krakow as well. So for us, it was very interesting learning. Like we can talk about that, but gazillions of challenges that were not even like part of this conversation because we only have 10 minutes. But it would be great to discuss and incorporate whatever feedback you may have and learnings that you have. And if you have a challenging problem, let's discuss. Thank you.
Thank you very much. That was last speaker of this part of today event. But I have one information to all of speakers. All of these projects have a chance to take part in accelerator program effect. If you want to know how to get this help for this acceleration program, in the main hall is some experts. So take this chance to you. Thank you. So it's time for a short break, and for 30 minutes we will see there again. Thank you very much, and see you in main hall.